Welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you news and issues around the National Health Insurance Scheme. In previous episodes of the program, we have brought you testimonies of NHIS enrollees, what they enjoy when they go to hospitals and are attended to without worrying about the bill. The questions many ask, therefore, are how do you become an enrollee? How does the NHIS register new members? And when you become an enrollee, how do you add dependents? These, amongst other enrollment issues, are what we shall be discussing in our program tonight. My name is Aisha Muhammad Ahmed, your anchor. Please stay tuned as I unfold the program for you.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. Top in our news is a report of the signing of a Memorandum of Understanding between the NHIS and Roche Products Nigeria Limited.
The National Healthcare Insurance Scheme has signed a Memorandum of Understanding with Roche Products Nigeria Limited in Abuja. Roche is a Swiss-based biotech company with differentiated and innovative medicines as well as diagnostic solutions in various disease areas. During the ceremony, the Executive Secretary Muhammad Nasser Sambo, represented by GM Legal Barrister Blessing Nonge, expressed excitement over the development, saying the partnership will help the scheme deliver better on its mandate.
We appreciate this MOU. We are happy it is coming at a time. This time could not have come at a better time. Like you rightly say, we are here to deliver qualitative healthcare to all Nigerians. That is the mandate. And we cannot do it alone. We need partners of repute like you to do this. And that you have offered to come up with this MOU that will support our operations is a thing that is not just commendable, but it is well appreciated.
Speaking on behalf of Roche Products Nigeria, Dr. Ladi Hamid, in an interview after the signing, spoke extensively on the MOU.
The essence of the MOU is to partner with the NHIS. On the first thing is to bring qualitative medications through a reimbursement model to make it available for cancer patients in Nigeria. And they are top-notch medications that are used all over the world, biologic medications, to make it accessible to Nigerian patients who have enrolled with the NHIS. Primarily for cancer treatment, they are first-class biologic medications that are used in the UK, the US, and we have to make it available for Nigerians. Yeah.
You are watching Easy Access to Healthcare for All Nigerians. The business of attaining universal health coverage can never be overemphasized. One major way through which the NHIS can achieve that coverage is through enrollment of enrollees. Dr. Eke Jonathan, General Manager, Formal Sector, speaks to us on the enrollment process involved in the NHIS, particularly in the Formal Sector Social Health Insurance Program. Keep watching.
Easy access to quality healthcare for all. NHIS.
I register my family. I register my wife and my family. NHIS have been helping in different ways. In terms of the charges, there's discount. So we appreciate their effort.
This service is very, very good because it helps the civil servant to reduce the burden they are having. You know, civil servants, they have a lot of burdens. But when it comes to this assessing healthcare, they don't, even if they don't have money, once they come to the hospital where they are registered for healthcare access service, they will receive them.
The satisfaction of enrollees justify the establishment of the NHIS by the federal government. But before the NHIS enrollee can begin to enjoy easy access to healthcare, there is an enrollment process that has to be undertaken. Dr. Eke Jonathan enlightens the public on how to get enrolled into the scheme for those in the formal sector.
The formal sector social health insurance is a program that provides coverage for those who work within formal employment. The people who work in the public sector, federal, state, local government, though in NHIS for now, what we are only covering those that work with the federal government. It also covers those in the organized private sector. So these are the people that are covered, including in the public sector. We have the armed forces, we have the police and other uniformed services. So that's what is covered for now. The enrollment into the formal sector, if you are a staff of an organization, what you do is assume that the federal government is paying for you. If you are a worker of the federal government, if you are of the organized private sector, we will expect your employer to pay for you. So once the employer pays for you, the next step is for you to come in and get enrolled. And enrollment is a long process that starts from registration. You come in, we register you, and following registration, we carry out a lot of processes, internal processes that will culminate in you appearing in our database.
Mr. Henry Duru of the Customer Service Division of the NHIS sheds more light on the registration processes as well as requirements needed.
Okay, for people that are coming in for that are in federal service, federal establishment, that is MDS, ministries, uniform men, and paramilitaries. The first step is that the person will get an employment into these establishments. Then from there, they will come in NHIS, any office of NHIS. We have statistics in Nigeria, and we have offices in all these statistics. They will go any office that is very close, NHIS office that is very close to them. They will go there with their original appointment letter, which the officer in charge will cite and return it back to them. Then we collect the photocopies. And another thing there, they will come with 3 months pay slip recent and their office ID card.
Mr. Dure explains also the plans that one can enroll in under the gift ship.
Individual 3 persons in a family, we subscribe for that one, and that one will cost 45,000 naira. They will now come with their passport photograph. Of course, they will also come with the functional email address, telephone number, their date of birth, and other things that are in that field that we need to fill, because it's online program. It's online that will fill the forms. So when you talk about family starts from 4, and that 4 will cost 60,000 naira. So as that individual is adding up, maybe the 5th person, it will go to 75,000 naira. Then the 6th person will be 90,000, till it get to 9. That is where the family plan stops. Then from there, group will now start. Group starts from 10. And that 10 can, from 10 upwards, even if it's 1,000, 2,000, 3,000, National Health Insurance Scheme can also register them.
The gift ship program and those in the organized private sector The process is similar because they share the same benefit package.
The other program that we are covering, which we call the group individual family and social health insurance, group individual family social health insurance, we see fitting within the purview of the formal sector, because the benefit package is what we are using to denominate it, and they are the same. Some people will tell you that it's for those who are in the informal sector, but it's neither here nor there. The only thing is that they are contributory schemes and enjoy the same benefit package.
Speaking further on the enrollment process, Dr. Jonathan Eke explains further on how a principal adds their dependents to their profile.
Well, the NHIS system is that you have a maximum of 6 persons. The principal, the spouse, whether the spouse can be the wife or the husband, and 4 children that are less than 18 years old. So when you want to, if you want to add any of them, what they normally do is to go to our offices, you fill in the forms. You understand the point? You can bring the passport of whoever you want to include and fill in the form, and they will put them inside the system.
Once enrolled, there is a waiting period before the enrollee can start enjoying healthcare services. Dr. Eke also speaks on the need for this waiting period.
There's no health insurance system anywhere in the world that you just enroll today and start enjoying tomorrow. All right? There's what we call waiting time. The waiting time is there for a lot of reasons. Though even within the NHIS system, you can realize that it's neither here nor there. But the waiting time is a time that you require to proceed for the administrative processes. In fact, some waiting time is used to check what we call adverse selection, moral hazard issues that exist within the system. In the GIFship, that is where it's even more important, because our experience with the voluntary contributors, what we call VCship, realize that there was an adverse selection. People just come in, you have a need to go for surgery, maybe cesarean section, you get pregnant today, tomorrow you enroll, and take your surgery and disappear. You understand? So we now have to go and redesign the program and introduce what we call the GIFship. So the GIFship, we are maintaining a lot of these waiting time things to keep. So in answering this, for the GIFship, you need 90 days from the date of enrollment to appearing on the register. So that is the... in the other one, what we have in this is that you need about 60 days.
Health insurance being a contributory scheme, different parties play different roles to see to its success. While the NHIS is the regulator, the enrollees also has a role to play as they access health care.
They have a lot of roles and responsibilities to one, in terms of enrollment, it is their responsibility to choose the hospitals that they want to go. We don't allocate them. So they choose. If they go to the hospital, they have any complaint, it's their responsibility to complain. In fact, they even have the right to ask a hospital, how much is my bill? Because what we are hearing is that some people go to the hospital and the hospitals are not telling them the correct thing. They will tell you to pay 10% of the cost of the bill, which is not correct. You only pay 10% of the cost of the drugs. So they have the right to ask, how much is the cost of the drugs, so that they know what the 10% means. All right? So that is one. So those are some of the roles. One is, this is equally there is when they are coming to enroll, they are giving us all those things that we are asking them to bring. I mentioned some of them. They give us employment letter. They give us a 3 months salary slip or pay slip. So these are some of the things that they have to do.
For the NHIS, hospitals and health maintenance organizations are critical partners in the implementation of the scheme. So what guides the choices of enrollees as it pertains to these stakeholders?
The choice of Hmos for now is we have allowed the employers to choose. You understand? Because there are a lot of issues. You know, the issues of information problems exist. Because if for now, but I know that part of the work we will do in future is that the time will come when even everybody will choose a HMO and choose employer. We are going there, but it's still work in progress.
Enrollment is open for anyone and everyone, as NHIS is keen on attaining universal health coverage. Social health insurance is the way to go in assuring Nigerians of easy access to healthcare anytime and anywhere.
Welcome to our stakeholders segment, where players in the provision of health insurance share experiences and enlighten us more on their roles while assessing the impact of the NHIS. On this episode, our stakeholder is Dr. Mohammed H. Aminu, MD, Venus Health Maintenance Organization. Venus has been in the business of partnering with the NHIS since 2005. He gives an insight to his operation as it relates to the healthcare delivery.
I can tell you that a lot of things have happened over the years. Where we started with just the public sector, and we are now permeating into the private sector and now into the states and local governments. So definitely there is much, that happened. And like I said, NHIS is emerging, and definitely we need lots of players, and we need lots of participation from the providers, and lots of awareness by the enrollees, by the subscribers.
He speaks further on the relationship and partnership between the HMO and the NHIS in delivering healthcare.
NHIS sets the rules, and we abide. So our relationship with the NHIS is to ensure that the enrollees that have paid for those services, definitely get the much needed services. So our relationship with the NHIS is to ensure that we implement whatever is set by the scheme.
Dr. Aminu describes the HMO as the engine room that ensures provision of healthcare delivery for enrollees, as he explains the responsibilities of HMOs to the enrollee.
When an enrollee gets registered with a particular provider, we, the HMOs, ensures that the provider provides the much needed services to the enrollees, so that he will not be shortchanged. That is our role, and we make sure that we also pay the providers according to agreed tariff, so that there will be much funds, in the pool of funds collected by either the NHIS or by the HMO, depending on which plan or depending on which aspect you are coming from.
How can HMOs help the scheme go beyond what it is now? Dr. Aminu had this to say.
Yeah, awareness and also confidence building on the part of the enrollees, on the part of the population. We need NHIS to drive the process, because people tend to trust what government brings. But we as private, organizations, we need NHIS to drive the process, to lead the way, so that people can give that trust. And I also want to point out that if the bill, rather the act, as approved by the National Assembly, if that is assented, And if it is made mandatory for all residents in Nigeria, to obtain health insurance, so I want to believe that there will be boom. There will be, like, if it is enforced. So a lot of people, rather everybody must enroll, as a beneficiary of health insurance in the country, and that will drive the process further.
That was Dr. Muhammad Hamidu Aminu, MD, Venues HMO, speaking on a range of issues around healthcare delivery and the NHIS. We will now take your questions in our last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: can an enrollee access healthcare outside his or her state of residence?
You may travel out of Abuja. If you are a resident in Abuja, you may travel to Lagos and you become ill suddenly. For example, you develop fever unexpectedly. And so you need to access care. You can go to any NHIS accredited facility with your means of identification. The hospital will treat you and call your HMO immediately. And so they will give the code and the hospital is able to claim their whatever they've used to treat you. So we have that policy under emergency. If you are traveling, you have your NHIS card and you are involved in a road traffic accident. If you are taken to any hospital and you are identified properly, the hospital will treat you, NHIS will pay.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
Easy access to healthcare for all every Saturday at 8 p.m. on the NTA network service.
One thing that has emerged from our package is that the NHIS as an organization doesn't leave anything to chance in ensuring that quality healthcare is delivered to enrollees. And towards this, it ensures its processes for enrollment are tested and trusted. As enrollees or potential enrollees, let us respect the processes and do things the right way. See you next week.